Hello everyone and welcome to another high-yield USMLE question. We have a 65-year-old male patient presented to the office with sudden onset pressure like chest pain on the left side. The patient has a prior history of diabetes and hypertension. Widely, the patient has a blood pressure that is slightly hypotensive. Pulse rate is 58, that's bradycardic. Remember, bradycardia here should not be expected here. So this means that there is something wrong, because if you have hypotension, then obviously you are expecting that it should be tachycardia. That's the normal response. So here, this patient's response is not normal. It is bradycardic, and we have to explain that. And the patient is afebrile. ECG shows ST elevations in leads 2, 3, and AVF. That's the inferior leads. So this is inferior wall MI. So you remember, for MI you need two contiguous leads, ST elevations. So this is ST elevations in 3 leads, so 2, 3, and AVF, which looks at the inferior wall of the heart. Angiography shows left dominant circulation. So which of the following is the artery occluded in this patient? So remember, this is a very high yield question, especially for your step 1, because step 1 is going to ask a lot of the arteries, the anatomy. So they're going to say, okay, so we have this presentation and this ST elevation, these leads, which artery is involved? So remember, when you have 2, 3, and AVF elevations, ST, so that's inferior wall, which is supplied in majority of the patients. That is going to be supplied by right coronary artery, because majority of the patient have the right dominant circulation. And we will talk about right and left dominant circulation, because you absolutely need to know this for step 1. Step 2, you may or may not need to know this, because this is a little bit of a more anatomical question. So we have to know the arteries. So now, first of all, the key points in the question are the bradycardia. So you have 58, that's bradycardic, it's not good. And ST elevations, like we said, this just tells you that it is inferior wall MI. And then very high yield detail here is that they already told you that this patient has a left dominant circulation. And remember, left dominant circulation is not very common. It's about 8% of the population that has left dominant circulation, and the remaining, it's about 88% of the patient that is going to have a right dominant circulation. So majority of the patient. Now, what does that even mean? Like when we say left dominant, right dominant circulation of the coronary arteries. So now what that means is that when you have it depends on the posterior descending artery, the PDA. Like what supplies the PDA? Remember, the PDA supplies the inferior wall. Here we know the PDA is blocked. Now what we need to know is that what is that PDA a branch of? Is it a branch from the left coronary artery, or is it from the right coronary artery? Remember, if it's right dominant, which is majority of the population, it is going to be from the right coronary artery. So majority of the patient, the PDA is a branch of the right coronary artery, but it's not going to be the answer here. The RCA is wrong answer here, because we have angiography showing left dominant circulation, which means that it is going to be an artery that is going to be supplying the PDA in a left dominant fashion, which is the left circumflex artery. So remember, if it's the left dominant circulation, the PDA is supplied by the left circumflex artery. If it is the right dominant circulation, which is most common, is going to be the PDA is going to be supplied by the right coronary artery. PDA, if you block, it's going to cause inferior wall MI. This patient has inferior wall MI. Here the answer is going to be B. Commonly wrong answer on this question was going to be C. Because it is the most common artery that supplies the PDA. It's going to be occluded in inferior wall MI, but that's the wrong answer here, because there's a little detail here that they gave. So now, inferior wall MI, such a high yield ECG that you need to know. For step 1, they may not want to interpret the ECG as well, but step 2, you definitely need to know the ECG. So here, RCA also supplies the SA node and AV node, and so that's why the patient is bradycardic here. And then in the right dominant circulation, which is 85% of the cases, that the right coronary artery gives rise to the posterior descending artery. Right. So a few percentage of people, are about 8%, are left dominant, which this patient is. With this patient is left dominant. It's the circumflex supplies the PDA, and so here it's going to be left circumflex artery that is going to be occluded here in this patient. So very high yield EKG to recognize. This is a more oriented to step one, so definitely high yield.